As part of my master's dissertation to become a specialist children's community nurse, I decided to create a new assessment framework for the children's constipation clinics. The idea being to bring standardisation to our documentation to enable a better sort of diagnosis system and to give the nurses a sort of standardised paperwork to work against. This paperwork has now been in place for about a year. Although we haven't done an audit, that is something I do intend to do, but we do hope off the back of this that the children and family have had a much more standardised approach when they come to clinic for a consultation. The quality is there now behind the nurses' paperwork for when other professionals need to contact us to discuss the children's care.
And she wanted to improve the outcomes that we had for children, and by taking the NICE guidance as the best evidence that we have for that group of children, she was able to formalise an assessment process and paperwork that we could implement fairly quickly actually, and she was quite brave because she was only Band 5 at the time, was challenging her Band 6 colleagues' practice, and she has the competence and confidence in what she knew was right to do that, and I think that takes quite a lot of gumption actually in a very established team of very experienced practitioners. And actually what she's been able to do is improve the outcome for the children. We've gone from an average of about 2.5 years of seeing these children down to about 8 months, which is less than the national average. We've gone from seeing children maybe 16, 20 times to a maximum of 8. We are much clearer on our referral criteria and our discharge criteria. We're able to stick to that, we've been able to articulate that. And I think for the nurses doing the clinic, it's giving them a lot more satisfaction, and the feedback that we're getting from parents and the children themselves is pretty much essentially very, very good, because they feel they're being listened to, they feel we know what we're doing, and we're able to guide them in a way for them to be able to support their own children and empower them as parents, which I think is really powerful, and it's a very, very good way of working, I think, for us as a team.